Honorable Chairperson and respected audience, welcome to my presentation. I am Dr. Santosh Saha, working as Assistant Professor in the Department of Pediatric Cardiology, National Institute of Cardiovascular Disease. Today, I am going to present my original research paper, and the title is Epidemiology, Clinical Characteristics and Outcome of COVID-19 in Children who is suffering from congenital heart disease. You know that the global pandemic of novel coronavirus disease caused by severe acute respiratory syndrome coronavirus 2, that is SARS-CoV-2. And this is began in Wuhan in 2019 in December, and then spread all over the world. And it is now well established that cardiovascular comorbidities are the higher mortality risk for COVID-19 in children. But patients with congenital heart disease might represent a high risk population. There is only limited data regarding this issue. Even in Bangladesh, there is no study at all. So we conducted a multi-center observational study to assess the epidemiology, clinical characteristics, and outcome of COVID-19 in children with pre-existing congenital heart disease. So our objectives were to find out the sociodiagramic characteristics of children with congenital heart disease infected by COVID-19, to identify the clinical profile of the children infected by COVID-19 who are suffering from congenital heart disease, and also to estimate the prevalence of adverse outcome in patients with congenital heart disease affected by COVID-19, and to determine any difference of presentation, severity, and outcome among the children with cyanotic and acyanotic congenital heart disease infected by COVID-19. This was a prospective observational study and conducted in the Department of Pediatric Cardiology, NICPD. And we collected data from the two centers. One is from our hospital, NICPD, another from the COVID-dedicated children unit of Dhaka Medical College Hospital. And the study was done from the January 2021 to December 2021. And all the patients of congenital heart disease who are RT-PCR positive are included in this study. And those are not willing to participate in this study are excluded. And our total sample were 34. We developed a standard questionnaire. Then data were collected by face-to-face interview wearing personal protective equipment. And we collect the demographic data, socioeconomic data, disease and therapy-related factors, investigations, and also outcome. And then we follow up this patient up to 3 months. Then all these information are included in the questionnaire. Appropriate statistical analysis was done, and before commencement of the study, the protocol was approved by the Institute Review Board of the National Institute of Cardiovascular Disease. Now the results. This shows that there is approximately 9% of the patients are neonate. This is so high. And if we add the neonate and the infant, that approximately 40% patients are infant, and then 40% patients are more than 5 years of age. And age and sex are almost equal. So reasons of COVID-19 test, you know that any procedure, before any procedure like intervention or surgery, their protocol is doing the RT-PCR positivity or not. So in this procedure, we found that 20% of patients who are waiting for intervention that are COVID positive. And also 11% are undergoing routine surgery. They also found also COVID positive. And approximately 59% were symptomatic. And 8% patients are history of contact with COVID-19 patient also COVID positive. And if we look for what are the possible source of infection, obviously the community transmission was the most common, 60%. And then significant amount of patients who are admitted in the hospital for other regions also found the RT-PCR positive. And if you look for the category of clinical category of COVID-19 in our 34 patients, most of the patients were moderate pneumonia and mild pneumonia, like influenza-like symptoms. And Severe sepsis or pneumonia also 9% patient, and asymptomatic patients were approximately 17%. There are lots of complications found in this study. We found that there are 47% are developed COVID pneumonia, then others complications like DVT, acute kidney injury, sepsis, pericardial effusion, and myocarditis also found. And all these 30% patients undergo echocardiographic evaluation, and we found that most of the patients are acyanotic congenital heart disease, left to right shunt like ASD, VSD, and PDA. Some patients, 8 patients are cyanotic heart disease like the top, tricuspid atresia, and also complex congenital heart disease like heterotaxy syndrome. And the secondary effect of COVID, we found like acute DVT in 2 patients, which is diagnosed by duplex ultrasound of the lower limb, and also pericardial effusion and myocarditis also done by echocardiography. This is a slide of, we divide the patient into complicated and uncomplicated divide, uncomplicated COVID, and we found that there is no significant difference between the age and sex affecting the patient with say, complicated or uncomplicated COVID. But in case of, we found there is the patient coming from the higher society are more prone to develop the complicated COVID than the uncomplicated. And this is also statistically significant. And also another, morbidity and mortality also higher in the found in complicated cases. And this slide shows the association of pneumonia with different types of congenital disease. If we see that there is more pneumonia is found in the left to right shunt acyanotic heart disease than the cyanotic heart disease. And our mortality was 5.9%, which is about high than the national figure. And we also found that significant amount of patients developed morbidity, that is persistent symptom, even after 3 months. And the persistent symptoms are cough, fatigue, irritability are the most common after 3 months. So, ladies and gentlemen, in conclusion, we can say that COVID-19 in neonate with congenital heart disease is not uncommon, and COVID pneumonia is more common in acyanotic congenital heart disease than the cyanotic heart disease, and higher mortality and morbidity is found in among the children with pre-existing congenital heart disease suffering from COVID-19, and no mortality difference between the cyanotic and acyanotic group, and cough, fatigue, irritability are the most common persistent symptoms. Thank you very much for patient sharing.